Hi, everyone. Welcome to today's session with the International Diabetes Federation. We will be talking about everything regarding respecting your limits as we celebrate World Mental Health Day today. We will have diabetes advocates and healthcare professionals discussing the link between diabetes and mental health. They'll be sharing their lived experience as well as hopefully advising us on how we can prevent or limit diabetes burnout. I am Kirsten de Klerk. I'm the co-founder of SA Diabetes Advocacy, as well as a project manager and a International Diabetes Federation YLD trainee from South Africa. And I will pass over to Ricardo now to introduce himself.
Hi, Kirsten. Hi, everyone. It's very good to have you here and to be able to discuss such an important topic as diabetes, but also mental health for people living with diabetes. I'm Ricardo. I'm here with Kirsten. I'm from Portugal. I'm 26 years old. I'm YLD trainee with the International Diabetes Federation and a representative elect for Europe. I'm living with diabetes for almost 14 years now. And I've also started a podcast with people where they can share their experiences living with diabetes regarding mental health and any other barriers that they have on their daily lives. So excited to be here, and thank you for being here.
We are going to be going over just some housekeeping rules. So this webinar will be recorded. You can activate Zoom generated subtitles for this webinar by clicking on the closed caption button at the bottom of your Zoom window. Please note that these subtitles are not always 100% accurate. The recording and feedback questionnaire will be sent to all registrants in a few days. Participants who attend at least 80% of this event live will receive an attendance certificate only if they complete a feedback questionnaire. Please check your spam folders if you have not received them by the 27th of October. And please also use the Q&A function to post your questions to the speakers. Thank you. Ricardo, over to you to get the intro for the speakers.
Thanks, Kirsten, and it's happy to see the comments on the chat and see that we are being watched by people from all over the world. I saw the UK, Bangladesh, I see India, I see a lot of people, and it's very good to have such a diverse audience on that side. On our side, we have also a diverse set of speakers today. So we have Diksha from India. She's the director of Diabetes Foundation. She's a psychologist, and she was also a part of the IDF YLD trainee program, such as me. We have Nasser. Nasser currently is from Bahrain. He is a patient advocate, a graduate student of psychologist, and is also an IDF YLD trainee. And we have Robin. Robin brings a psychotherapist experience, and she's IDF Blue Circle Voices member from the United States of America. So we are covering a lot of ground here, not only geographically, but also from experiences and lived experiences as well, and we are excited to share that with you today. So thanks, Kirsten, and if you want to kick off with the first question, I'd be happy to.
Wonderful. Hi, everyone. So the first question that we have today is around your experience with diabetes and mental health in your years that you've been living with diabetes. In my experience, I have been living with type 1 diabetes for 13 years, and never once have I been screened for diabetes distress or burnout. Even when I was showing severe signs of burnout, I was in a phase of not even testing my sugar levels. I was avoiding visits to my doctor. I was lying about my glucose levels, and never once was I referred to a psychologist or to someone that would be able to help me understand what I was going through. So I want to ask Nasser, maybe we can start with you. What has your experience been with mental health and diabetes?
Yeah, so hello, Kristen. Hello, Ricardo. Hello, everyone. Just a quick introduction. My name is Nasser, as Ricardo said. I'm from Bahrain. Most of my advocacy and work kind of revolves around psychosocial factors involved in diabetes management. I think with my journey, it's been obviously like a lot of individuals living with diabetes. It's a lot of ups and downs, right? We don't necessarily have like periods of diabetes distress and then it's all good, and then it's a lot of ups and downs, and there is a lot of contradictions, I think, with what we feel, and there is a lot of complexity. I think mostly I struggle with diabetes a lot of times when I'm traveling, like on trips, on my studies. the preparation that I have to go through. So an individual, quote unquote, who's normal and healthy, so non-diabetic, has to deal with, kind of cultural shock and, getting kind of used to the new place. But you also have this thing that's also on top of it that you have to kind of deal and moderate and kind of address at all times. But I think, yeah, like a lot of the times it's about access to technology, it's about, culture, it's about a lot of other things. But yeah, there is a lot of up and downs, I think, when it comes to diabetes distress. Yeah.
Thank you for sharing that. I know Ricardo and myself have had this discussion before where you're trying to live your life and enjoy the moments, and it feels like sometimes diabetes can kind of take away from that. I myself have been experiencing that. I'm in Europe at the moment, and it's just that extra thing that you have to think about when you just want to be living your life and embracing the moment. So thank you for sharing. Deeksha, on to you, please.
Hi, I'm Deeksha, and I've been living with type 1 for the last 23 years. I live in India, and I have been a practicing psychologist for the last 5 years with my niche of working specifically with people with distress and burnout. And in 23 years of living with type 1 diabetes, never was I screened, or never have I seen anyone being screened for diabetes, distress, or burnout. And the fact is that it's neglected under the carpet, just saying that, oh, you're not taking care of yourself. A lot of times healthcare professionals, and no offense to anyone here, but that's what I have experienced, right? They'll just neglect that bit of your diabetes management completely. They'll just look at you and like, oh, you are not doing something right. Your sugar levels are fluctuating because you are not taking insulin on time, or you are eating something extra, or you are not monitoring and stuff like that. But no one understands what is the underlying factor, which might be the reason why you are not taking your insulin on time, why you're not monitoring. And these underlying factors are just not, they're just not physical. It's also stigma. There are a lot of social determinants, what Nasser said, right? There are so many psychosocial determinants which come into play. It's so intersectional ultimately. But to answer your question, no, there has been no screening yet. And that's where my role comes in. Someone who is living with type 1, who is also a psychologist. So I know the kind of struggle it comes with. So I kind of started with YLD, IDF gave me a platform where I started my project on mental health and type 1 diabetes, where I just wanted to make sure that that missing piece of puzzle is somewhere stuck and the puzzle's complete. And then we also consider that mental health is important for someone who is living with a chronic condition where you have to make so many decisions. Just to give you a small example, just before sitting for this webinar, I had to check my sugar level, ensure that I don't go into a hypo or a hyper, kept a juice box, kept my glucometer, kept my insulin with me, everything, so that if I end the webinar, if I go through something or the other, because I don't know, I will just, I'll just pick it up. So this is the kind of mental load that we have to take on every day. Research suggests that we have to make 180 more decisions per day. So just imagine the kind of load that we are taking.
Thank you, Deeksha. I think you perfectly put into words there what I'm sure many of us sitting behind the screens today are having to cope with, having things available just in case, because you never know when things can take a turn, and the sort of burden that puts on us every single day. Robin, if you would like to add your comments.
Sure, thank you. First of all, it's great to be with all of you today. I feel very lucky to be part of this. So I'm Robin. I live in the United States, and I have type 2 diabetes. I've had it for almost 20 years now, hard to believe, but yes. And I think one of the problems I've encountered over all these years of living with diabetes is, I'll call it a double stigma. The stigma of having the illness, and then the stigma of it's not easy to deal with it. So there's a mental health stigma. So, and then access to a comprehensive way of treating diabetes is really hard to come by. You have to really be a great advocate for yourself. And mental health is not addressed. So one of the things that I've done over these years is I was fortunate to be part of a national organization that recognized the need for more support. And I became a peer leader, co-leader with a group that met monthly to address just the kinds of things we're speaking about. You know, the peer support, peer-to-peer, is very meaningful, because when you're talking to a professional provider, they may not understand what you are all speaking about. When you're peer-to-peer, as we are now today, we understand what we're speaking about. And that made a huge difference for me in coping with the day-to-day challenges. I'm not insulin reliant, but all the different medications I've needed to use have created all kinds of side effects. So I would go hopefully towards the next medication, and then it wouldn't work so well. So I've been on every medicine known to mankind. So you almost feel a little bit like a guinea pig as you try to find the right medication. And then the guilt, I would say, of not being on top of it. So because then you feel, what did I do wrong? And that also takes a mental health toll, feeling like somehow you're failing at your self-care. So it's a real day-to-day challenge. And I found just talking to others helps me enormously. And that I seek that. And I fortunately have these supports through the organization I'm in. So that's my story.
Thank you for sharing that, Robin. Thankfully, there has been quite a drive towards clinical advocacy and getting healthcare professionals involved in advocating for the people living with diabetes. Ricardo, I'm going to pass over to you to share your experience of that question, and then you're welcome to go ahead with question number 2.
Thanks, Kirsten. And yes, it's obviously quite relatable. And one of the better aspects of having this community and these sharing sessions, and that's why it's so important to have these talks, and it's such a great initiative, is that we can relate, right? So when Nasser speaks about traveling, I totally understand. So I recently been to the US, and I actually connected with Kirsten on it, because it was really hard to manage the stress and the heating, and every meal is now an adventure. And it becomes like that, and especially in professional settings. So when we need to travel for as a student, or as a professional, as a consultant, or when we have these short-term experiences, it's even harder, right? Because we don't have time to adapt. We have time zones, we have these meals. And I think that's one of the biggest impacts that I've saw in my mental health as a person living with diabetes. It's that it just at a certain point, it just gets very heavy to carry. And unfortunately, you can just buy the extra bag and just put it on the plane. You need to carry it with you. And yes, I think that's most of my experience. On the other side, I think I've never looked into the mental health question as a mental health question. I always looked at, I'm tired of having this. I'm seeing a number, and I need to act on the number. So I see a 300, or the equivalent in the other scales that you might use, and I need to put it down. I see a 50, or the other number equivalent, and I need to put it up. So I guess it's a game that we eventually never win. So we are always playing this, and that actually, what really turned my attention into the mental health part was when I started to understand that I was playing this game and I couldn't get out of it. Until I think we all have that perception, and yeah, it's quite important to understand. And I think I would use this to pivot into the second part of the second question, which would be, most of you spoke about the lack of not treatment, but attention from the healthcare professionals that you've been in touch with. And I believe, and I saw that we have a couple of healthcare professionals in our audience as well. And we thank them for being active and for being involved. And I would take this opportunity and just ask, in your opinion, what can these professionals and the healthcare providers that we work with can do better to support the mental health of people like us living with diabetes? I would start perhaps with Robin, considering that you have a different experience from the type 1 or the types that we have here, and just trying to understand, what would you like to see, considering that the double stigma that you mentioned, I think it's quite real. But I also would say that within the types of diabetes, there's also additional stigmas and the different experiences that we have. So I would ask you, what would you like to see, or what would be beneficial for your mental health with diabetes by the healthcare providers?
Well, I would say that in American health, in the healthcare system, it's very specialized. And so people are not seen in a comprehensive whole way. And that's what we're all noting, that we're fortunate to have access to medical care. Of course, I'm incredibly grateful to have that, but it's very compartmentalized. And in my efforts to create more support for mental health and diabetes, there's enormous resistance in the medical community to looking at that. Maybe they feel like they don't want to take that on. They have enough to do. There's pressures. I totally respect the responsibility of their role, but letting others come in, support people who, like the groups that I've been involved with, there's enormous resistance in the medical community to, support that effort. And I find that very incomprehensible, because if you want to help people feel well, the burdens of this is so enormous. And it's not just a doctor's visit or a number. It's something where a community comes together to fill in those, missing pieces of the support that we all require. So I would say the medical community needs to be better educated and not so resistant to letting other services come in to create patient well-being. That would be my first effort, to get the medical community more on board with the need for this. And they'll have better compliance, and they'll have healthier patients who don't feel, I messed up. You have more control when you talk to other people. You develop other networks of support. So anyway, to surmise it, to make it simple, get the medical community on board more with supporting people with diabetes.
That's a great point. And again, I think we have the network effect on our side and we feel it, right? So we are here and we are discussing this. And I feel like we can also definitely benefit from having the network effect on the other side, and also perhaps stop putting things into boxes, right? And just trying to understand that I don't need to see a specific type of practitioner for this. We might need a team, right? We might need a full set of different functions, of different expertise to help us. Because sometimes it's not only the complications, right? We focus a lot on physical complications because, well, we all know that we have a wound, we can put a bandage on it, but
yes,
perhaps we have more than that, and sometimes we need to go a little bit extra than that. Thanks a lot, Robin. And Nasser, as a student and as an aspiring professional in the area, what are your take here?
Actually, I agree a lot with what Robin mentioned, and a lot of my research and a lot of the conversations I had around psychology and around diabetes as well was about how the account of diabetes, or the account of the psyche and our mental health today, is too medicalized, right? A lot of what we screen for, even something like diabetes, the stress, even something like depression resulting from another condition, is a little bit too medicalized. So we look at symptoms as a cluster. When we look at the stress, we look at, okay, so they have X and Y and Z, so they're distressed. But we have very little account of the biopsychosocial. This is what they're trying to call it now, the biopsychosocial. So we want to see kind of the interaction between the biology, right? Because your high blood sugar puts you in a bad mood. Your mood swings come from, a lot of the times come from diabetes, and a lot of biological interactions as well. So I think one of the, kind of to go back to the kind of main framework or the main question, we need an integrated and holistic and a comprehensive treatment. We need to be looking at biopsychosocial at all times when we're looking at individuals. A lot of the times they're advocating for psychodynamic, kind of a way for us to start looking at ourselves from all of these angles. One of the issues maybe kind of bringing it back to kind of a more diversified and maybe a decolonial kind of aspect of diabetes distress. When we look at distress, we look at a very Western way of approaching distress. So the application of that to other individuals or other communities or other societies or different cultures might be limited. So kind of going back also to Kristen's point, do we necessarily have to be screened for diabetes distress? Maybe yes, maybe no, but definitely that's not the end point. I think we need a so much more integrative scope when we're looking at diabetes or looking at mental health generally. That's what I think.
That's a great point. And again, the culture aspect also weighs a lot. And I think that's a big aspect that we can explore. And Diksha, I would refer to you here. So being in India and living with diabetes in India, and we all heard some stories potentially about people having these, again, the stigma, right? So that they are not the same type of people that other people are that are not living with diabetes, and that perhaps they can't do certain things, or they can't aspire to do certain things or pursue the dreams that they have. Just wanted to understand, how did the cultural aspect here was important, and also how does the healthcare providers can counteract a bit of these mental stigmas that people grow up with and are hard to conquer.
Right. So when I talk about type 1 diabetes, I never see it as an individual condition. I see it that when a child is diagnosed with type 1, the entire family is impacted by it in different ways. But I always say the entire family has type 1 now. Siblings get impacted in a very different way. You know, there might be a feeling of neglect and all. Parents, there's a financial burden, there is an emotional burden that comes in. So everyone has their own way of looking at type 1. And the problem with our healthcare system is that doctors do not have time because our healthcare system is so burdened. The most that you can do is give 5 to 10 minutes to a person, and explaining them how to live with the condition for the rest of your life is impossible. I can't even just, imagine that happening. So I think what all of us, like Robin said, or Nasir said, or Ricardo, for that matter of fact, you said, we need a holistic 360-degree care system, which does not just involve a diabetologist or an endocrinologist, but we also require diabetes educators. We also require psychologists, trained psychologists who have worked in the field of health psychology, because a lot of times I've seen in my own field that a lot of times type 1 is not even considered anything. It's just, the nuances are not taken into consideration, that I might be overcompensating academically or professionally because I have type 1 and I have this innate thing is subconsciously in my head that I have to, just kind of put that bandage on that flaw, that I do not want people to look at that. So holistic approach is extremely, extremely important. I'm seeing some healthcare professionals in the chat box talking about education. Education, I feel, is extremely important, not just for the stakeholders who are in the type 1 diabetes management system, but also beyond that. We live in a society, we are ultimately social animals. We need to tell people that, this is a abnormally normal thing, but do not look at my child or me through the lens of pity. That is extremely important. And that's what we have seen in India. There's a lot of pity party, and there's a lot of unsolicited advices that we get. If I tell someone that I have type 1 diabetes, oh my God, the kind of advices I'll get: have the bitter gourd water, do this, do that, go there, do this, but cure your child. So just imagine so many sounds coming in and the burden that ultimately results into diabetes distress. I think we need to shush that noise, and that will only come if we educate ourselves, educate others, and learn that a lot of times the comments that come to us are out of ignorance, and maybe out of complete ignorance and unawareness about the condition. So just learning to break that stigma is very important. Those are my 2 cents on the cultural, aspect, and also the fact that how can healthcare system, just summarizing it in one line, the healthcare professionals who are watching this live right now, this webinar right now, I request you all to be a little considerate about the mental health aspect as well. As I was saying, the person who's coming with type 1, the patient that you're seeing right now, might not be taking insulin because there are 10 other mental health factors that might be resulting in that person not taking insulin on time or monitoring. It can be anything. So just maybe a minute or two, take some time to, fiddle around and figure out that what exactly is happening. That might break the ice, and you might actually find the exact point where and why the child is going through whatever that they are going through.
Thanks for sharing it. With all the negative aspects, at least you know that if you're in a party, you can use that as a icebreaker, right? So you can say that you have type 1 diabetes and people will try to give counseling for free, which is not the best, but can be a way of mingling. Nasser, you had your hand. You want to add something here?
Yeah, I think I loved what Diksha was saying about culture. And, one of the problems I have with a lot of the measures and a lot of the interventions that are tailored in the West is a very narrow view of culture. And I think there is a very nice light that Diksha was shedding on how culture can have a lot of intelligence when it comes to social support. I know you kind of looked at it from a different aspect than what I'm saying, but kind of part of what I do as well, in my research, and one of the studies that I'm kind of conducting is looking at spirituality in a cultural context. Yeah, not spirituality like yoga, spirituality in a kind of a more kind of inclusive context. Yeah. And you kind of are able to see then how the role of social support is a huge predictor of diabetes management. Yeah, when you have people around you, just like Diksha was saying and Robin was saying, and you can talk to about diabetes. A lot of my interventions was just bringing diabetics together, nothing more than that. And then, is my internet okay? Yeah. Okay. And just kind of bringing people together to just have them talk about diabetes. And then, I talk to them and they're like, yeah, I have my CGM on after the session. And then they're like, my diabetes has been so much better after just the conversation that we had. You just kind of sit down and vent. I think there is the huge impact that spirituality kind of plays in that. The coping mechanisms that culture uses, I think there is a lot of intelligence behind it. There is a lot of intelligence behind people coming together, doing things together, talking about grief, talking about illness, talking about depression together. So yeah, that's just something that I wanted to add to Diksha's point. Amazing point, by the way. I really loved what he said.
Thanks, Nasser. Robin, you want to add?
Yes, just wanted to say that, one of the things that's so difficult about managing a chronic disease is feeling a helpless feeling. And when you could do things that give you more sense of advocacy and empowerment, it makes you feel better. So when you're in a relationship with a provider and they're the authority and you're not, and you're dependent on them, that already makes you feel badly. So one of the things that I think that's very important is feeling your own agency and that you need to be a really good advocate for yourself. And again, my experience of being able to start support groups, I saw the need. And, another person who's type 1, actually, she's type 1, I'm type 2. So we felt it was a very interesting combination because often people with type 2 feel like, well, it's, you caused it, you feel guilty about it. There's a whole set of factors with that. And she and I were able to really understand each other. I helped her understand what it's like to be a type 2. She helped me understand what it was like to be a type 1. And often when we're together, I want to know what she's experiencing. And I would say with people who don't take it seriously, have them walk through a day with you to see what it's like being a type 1. And when I'm with her, I'm always like, I want to know. So I'm very interested in what she's experiencing. And there's no way you can understand it unless you either, like you guys, live with it, or you get people who really want to understand it and they go through a day with you and what you're dealing with. And then they're not going to be flippant or blame you, or they're in the experience with you as an educational, getting support and helping people understand what it's like. But I just think advocacy makes you feel better, and whatever you can do in that regard, including, well, the resources are not there. And I think that's another problem with identifying this as an issue. What are the resources? If you're seeing a healthcare provider and they can identify you have diabetes distress, you're burned out, then what do they do? And the other thing I'm addressing then is the lack of resources. because there aren't a lot of resources. So what do you do? I think your point, Isha, was that even if you're a provider and you can't do much, just asking or being sensitive creates a different feeling in the room, so that you know that the provider is aligned with you and they understand. They're asking the question. They're not just ignoring it, which has benefit too. But then, where are the resources? And I raise that as the next question. What do? You identified as a problem. Then what happens? What do you do about it? So just another musing.
Robin, you raise a good point, and something that we have seen on the Q&A here from the audience, and just trying to gather their needs as well, is trying to understand. So you spoke about spending time with the people that lives with diabetes, right? And again, the healthcare professional on the other side has this limited amount of time. But what we would like to understand is, what is the type of healthcare professional that actually you see to discuss these things? So are you speaking with a psychologist? Are you speaking with an endocrinologist? What expertise of the healthcare professional are you seeking, and you have access to when you want to vent, like Nasser did, or that mentioned, or you just want valuable information and avoid this storytelling that happens when you say that you have diabetes?
Right. So are you asking, who do you go to? Right. Well, I think, it would be great to see someone who has expertise or understands what you're dealing with. Like, for instance, with me having the disease or the illness, I understand what it's like. So I would be more sympathetic. All of you the same, because, you're all people with diabetes, but you're interested in healthcare and so on. But it's very limited. So I think that's where we come up with a huge problem. It needs to be understood better and acknowledged as an issue. And then maybe there could be more resources created. That's where the peer support mechanism I found so valuable, because it wasn't led by a professional, but it was led by peers. And peers can do stuff. It's like a grassroots movement. So instead of starting from the top, looking up for something, you're saying, on a grassroots level, I want to have support, and we exchange information. And that's another function of peer support, is that people have stories and information to share. So I guess that's been my remedy, has been on a peer level, peer to peer. And I also think that there needs to be more understanding and more acceptance on the healthcare side of what it means, and more education for healthcare people. And do you go to a psychologist? Yes. Do you go to a social worker? Yes. Do you go to a licensed professional counselor? Great. All these people are wonderful, but they're limited. So I guess my answer, the solution I found was the peer-to-peer support. But that requires organization. But any of these problems are going to require, resources.
Yes, and I saw an expression that I really enjoyed on the comments, which is, it's not the healthcare provider, it's your team, right? So it's a way of having people behind your back, and on my experience, for example, and before passing to Kirsten, I've always had the same doctor for a couple of years, and I was never able to bring or to build this relationship, even though I had these yearly checkups, because I was just another patient, right?
Yeah.
It's fair. It's fair. We need to understand that we are one-to-one, because it's us, it's our life, and it's our doctor, but it's one to many from the doctor's side. And that's a very important thing to realize. And again, the value of the peer network is quite interesting. And flying over from the US to South Africa and passing to Kirsten has been involved in a lot of these initiatives of bringing the peer connection and the peer information to leverage potentially the lack of resources that they have on our side. So Kirsten, do you want to share this experience and also the feedback on this topic?
Yeah.
Sure thing. So something that has worked quite well in South Africa is, a lot of people were seeking resources and then, kind of going to any dietitian or any healthcare provider, and they didn't quite understand what it was like to live with diabetes, whether you had type 2 diabetes or type 1 diabetes. So what we ended up asking our community members was, who is a psychologist that you see that has experience with chronic conditions? Because the last thing you want to do when you're really looking for help is to go sit in a room with someone who doesn't understand at all what you're talking about and spending all your money and time and effort trying to explain to them what it's like to live with a chronic condition rather than actually getting to the crux of what you are not dealing with. So I think that really helps. So we kind of started a community list and we asked people in the community, who is a dietitian that you go to that understands diabetes? Who is a psychologist that you have gone to that understands diabetes? And we shared these resources with the community so that instead of going to anyone that you see online, the first person in your area that pops up, you can actually go see someone that has had prior experience dealing specifically with diabetes. And then again, as Ricardo was saying, is, it is your healthcare team, and it's something that you need to feel safe enough to do with your healthcare professionals to bring up these topics of conversations. Because as Diksha was saying, you've got like 10, 15 minutes. So if that's not something that you're raising or something that you're wanting to talk about, or if it's not a safe space for you to do so, then as Ricardo was saying, he's been with his healthcare professional for many years, probably since diagnosis. Sometimes it's actually worth looking at your own healthcare team and thinking, you know what, this isn't actually working for me, this relationship. It's not a relationship that you have to keep for the rest of your life. And if you feel that it's not a safe space for you to discuss these certain things, then it's time to look elsewhere. And community can really bring that support by discussing in the WhatsApp groups, on the Facebook platforms, who they are seeing that are actually helping with diabetes specifically. I'm going to be going on to the next question, which is, what advice would you give to someone who is newly diagnosed to diabetes, particularly with regard to the importance of mental health and self-care? So what sort of check-ins do you do? How do you kind of know the signs and symptoms? What is it that you generally notice about living with diabetes and mental health that you could possibly share some advice with those that are newly diagnosed so that they're aware of it if the time ever comes up? Diksha, I'm going to go on to you.
All right. So for anyone who gets newly diagnosed, it's first of all understanding that it is a capital T trauma, which is life-changing. It's not a small trauma. This is going to change your entire life you are going to live with this for the lifetime. And if your child is living with it, be mindful that you might live with it vicariously as well. For a young child, because I was diagnosed at the age of 4, I now realize at the age of 27 that my parents also experienced hypos and hypers along with me. My sibling also experienced all of those feelings with me. So just for anyone who is newly diagnosed, what Robin said, and all of us have been talking about, finding a support group. So this is one thing that I request all the healthcare professionals, that putting anyone who is newly diagnosed or has been a veteran in type 1 or any kind of diabetes for that matter of fact, please put them in touch with the support group. When a person who has the same lived experience speaks to the same person, trust me, it makes a lot of difference. It's not clinical. It's very, it comes from a space of heart. It comes from a space of lived experience, which changes the entire narrative. Maybe they'll feel more accepted towards it earlier than it would have taken them. Secondly, that take your time, because you're going to go through the stages of grief. You're going to go through anger and frustration and denial, and then going through that entire phase of burnout and might go into depression. But before you fall into that pit of depression, find and build your village. Start learning about the condition. I think what helps anyone who is newly diagnosed is understanding the condition better. I always tell people that, and having this facade, a lot of times denial comes in this facade of, no, I'm normal. No, you are not normal anymore. You're abnormally normal. You might not have those horns and a tail, but you're not normal. Your pancreas just said goodbye to you. It's not going to produce any insulin. You have to take it from outside, and it comes with a lot of complexities. It comes with a lot of burden as well. But how do you incorporate that? burden apparently, and not see it as a burden, eventually is going to come very organically. Um, Lastly, do not see diabetes as something that you have to fight. You have to live with it. Just imagine it as a clingy roommate or a boyfriend or a girlfriend, I don't know, but a clingy someone who is just going to stick with you for the rest of your life. So, how do you deal with a clingy person? You give them compassion, you give them a lot of support, you look at it, you be compassionate towards it, and it's not going to hurt you, I promise. If you are compassionate towards your own body, trust me when I say this, that diabetes makes you so much aware about your own body, and it makes you appreciate your body so much because it's constantly working, and there's so much happening, and then you realize that, damn it, I have ignored my body for such a long time. Maybe now is the time. So just seeing it as a clingy person that is going to live with you for the rest of the life, hopefully till the time we don't find a cure, but till that time at least, it's going to live with you. And how are you going to treat that? Either you can fight with that person or with that condition constantly, that no, I am a warrior, I have to fight with this, I have to, cut this, this, do something about it, just be extremely frustrated about it. Or you can just look at it, have a word with it, and be like, we need to have an amicable relationship with each other. Sometimes that relationship is not going to look amicable. Trust me, it's going to be a roller coaster ride. But just creating that compassionate space with your own diabetes is so important for anyone who is newly diagnosed. So, again, for doctors, healthcare professionals, it's very important you please put them in touch with the support group so that they speak to someone who has lived experience. Trust me, it makes all the difference.
100%. Thank you so much for sharing that. I love your analogy of it basically being like a relationship that's going to be with you for the rest of your life. And something that that's really helped me in my journey with diabetes is on my Diversity. I'm not sure everyone celebrates it, but it's basically the diagnosis date where your life changed forever. And every year on my Diversity, I sit down somewhere by myself and I write a letter to diabetes. And I write a letter to it to explain everything that I wish I could say to it if I could talk to it. And it's been a really, really lovely journey to kind of keep those letters and read them as the years go by and see the progress that has happened in my journey with diabetes. And it's something that I really, really recommend to anyone living with diabetes, is just to say all the things that you wish, if it were a person and a real relationship that you could see at face value, to talk about it and to talk to it about the things that you would change. And then the point on the support group, 100%. Unfortunately, when I got diagnosed at the age of 16, I was a little bit rebellious and I had no sort of inclination to want to be friends with other people living with diabetes. And only much later, which is what was part of my journey, did I realize how valuable the online community is, and being able to connect with people all over the world that live with diabetes and to share their lived experience. So unfortunately, that's something that I think people need to keep in mind as well, is that everyone's journey looks different. You might not be ready now to connect, but it's just always keep that door a little bit open so that when the time comes, you have the information and the resources available that hopefully your healthcare professional is sharing with you. Nasser, on to you, please. We'd love to hear your opinion on what advice you would give to someone just to look out for the signs, symptoms. Did you have any specific, if you've experienced burnout before, what were the sort of signs and symptoms that came up for you?
Yeah. So I've worked with a lot of individuals who kind of got recently diagnosed, and I'll try to kind of generalize kind of a pattern, but it's very person specific, yani, because there is a lot of grief, I think, with kind of getting diabetes. There is a lot of accountability, there is a sense of responsibility, there is a sense of loss that comes with diabetes, right? And I don't know if you guys had a kind of a similar experience. I got diagnosed at a very young age, so I got only to hear that from other accounts. But with a lot of the times, I think there is a lot of grief when it comes to diabetes, and would be very interesting to kind of explore where that grief comes from and how you're dealing with it. That's one. Second is, from a lot of individuals that I worked with, there was a huge need for control and responsibility. So with one of the guys I worked with very recently as well, he was diagnosed at 50, and I met him, kind of 2 months after he was diagnosed. And he was so scared that his blood sugar was like 12 or something. And I'm like, my blood sugar, if it's good, it's like 12, you know? It's, yeah, and you're having a good day when your blood sugar is averaging at 12, but it's okay, you know? And he's like, I lost a lot of the things, you know, that I used to do. I can't do anymore. And I'm like, what did you lose? He's like, I can't eat cake. I'm like, let's go eat cake now. Let's do it. It's okay. But with a lot of it comes a lot of loss, I think, comes a lot of changes in the lifestyle, comes a lot of feelings of control and responsibility. And just going back to what Robin and Dishka said earlier as well, with, you know, having a psychologist or having someone who's kind of aware of these mental patterns, it would be interesting to see what underlying schemas do we have with diabetes? What type of person is diabetes creating out of us? Is it someone who's super responsible and someone who's very controlling? And that's fine. It's fine if you are. But it would be interesting to kind of involve a little bit of flexibility in that lifestyle. Going back to what Diksha said about Dishka, am I pronouncing your name right?
You are.
And you know, just a lot of it has to do with advocacy, and again with Kristen. I think when I started my advocacy, when I started going out and meeting people who are diagnosed with diabetes, who have similar lived experiences, I think your experience just elevates and gets, you know, you're able to see it as is. Not that it's easy, no, but you're able to see it and manage it, I think, a little bit more controllably in a way. That's what I think about this. Yeah. But just one more thing. I think with, you know, with a lot of the accounts and with a lot of the memes that I've been watching, yeah, I've been going through on Instagram with diabetes. I love them, by the way. Love them. Yeah, they give me such a nice perspective when it comes to diabetes. But again, diabetes in itself is transformative. It is transformative. Yeah, a lot of my personality, a lot of the controlling aspect of my life, a lot of my flexibility, a lot of the awareness I have in my body, a lot of my, you know, speeches, a lot of what I do a lot of it comes from diabetes. So it's difficult, but I think a lot of it is a transformative experience. Yeah.
100%. And I think those that are deeply entrenched in the community, you know, you start wondering how different your life might have looked if you weren't diagnosed with diabetes. You know, what community would have you become a part of? You know, what would you be doing with all the spare time and the thoughts that you have on a daily basis? Like, what would be taking up your mental capacity on a daily basis if you weren't having to deal with the carbohydrate counting and the different technologies and all the things that you have to think about on a daily basis? It's definitely something that's come up. And yeah, you spoke about the grief, and it's something that has never actually been brought up in my diagnosis journey, you know, the grief of a life that you would have lived versus what you live now. And I think also we call it type F, so your family members and your friends, and it's how it impacts your bigger circle. You know, how does it impact your family dynamic? I recently had a discussion with my brother about the impact of my diagnosis on him growing up and how that looked for him, and it's incredible. You don't realize how it affects your family members and your friends around you, because I think at the time it's just information overload, and you're just really trying to look like you're doing your part. You know, you're just looking like you've got this. You know, you're just trying to show this brave face the whole time because you don't want people to worry about you and you don't want to be a burden to others. So I think it just opens up a big can of worms. But I'm going to pass over to Robin if you've got any thoughts on that, on the type F specifically. Sorry, Robin, you're on mute.
Okay. Hi. So just regarding, there's so many wonderful points everyone's been making. The first part of the question was about when you're first diagnosed, when you're newly diagnosed. And I think there's absolute phases people go through. I know for myself, it was shock, it was denial. It took me many years to really acknowledge what was going on. And I retreated in denial. It took me years to get to the point where I did what I could. I became more active in my self-care. And that became a very important lesson for me that I think Diksha was saying this about compassion. And instead of feeling blame and guilt, it took me time to get to that place. And I still try to practice that on a daily basis with mindfulness of having compassion for myself. and not being angry at my body or at myself for not doing everything I should do. Because that's another part of the diabetes distress, is you never feel like you do exactly what you need to do. And, but that's an impossible goal. We're never going to eat the exact amount of carbohydrates required to keep our blood sugar at a certain point. These are fluid systems that we can't control fully. We can do our best. So I think these movements of, from denial, acceptance, learning a lot, which is one of the things for the internet that I feel so grateful for. Like right now, sitting with all of you in the audience, it's an amazing thing that we can access each other this way. And that's another shift for me mentally, has been not to feel just burdened with an illness, but to figure out what are the strengths of the illness. And I've grown a lot because there's been opportunities I've gotten to be an advocate. And that has changed my feeling about what I'm dealing with, because you're not just stuck with a difficult illness that you have to manage. There's a lot of strength that I've witnessed with people dealing with it. And I like to look at the strengths, and also that we have power when we're talking to healthcare providers. We're not just passive. We can speak, we can advocate. So I think that mental shift has helped me enormously. And I feel like there's a lot I've gotten from being in this position. And so it's made me grow. And I think Nasser was saying that too. I mean, when I hear about all the research you're doing and your interest, to me, it's like, okay, you take this thing in life and you grow with it, and you expand it. You too, Dick, like, just to hear what you've been through, like it deepens you as a person. So I don't want to, make it sound like a picnic, far from it. But I think it's finding the strengths that you can cull from it that has helped me a lot. And also, just last thing about family and friends, if you're in charge of knowing what you need, you can tell family and friends. They don't know what to do. I've experienced it. They're clueless. But if you are owning what you have to deal with and you tell them, then they can give you what you need. And if you can tell them when you're distressed, which I kept to myself a lot because I was ashamed of it, I didn't want them to know, but I changed that. It's like, this is what I need. I'm feeling down. I feel, etc. My family has expanded, so we can actually communicate better. And last point is, when you're owning your illness and you're taking care of yourself through nutrition, you also improve your family's life too, because you're making them more conscious about what's better to eat for their body. So it can have good outcomes.
100%. Thank you so much for sharing, Robin. I think, your point on the fact that, as Nasa was saying, we receive good and bad from this diagnosis. It's not all bad. And I know that there are times when it feels like it is all bad, but, on the other days, and reaching out to the lived experience and other people that live with the condition can really, like, sometimes I just phone up a friend and I'm like, I'm having a tough day. Like, you're the only person that would understand, this feeling that I have right now about eating a sweet. No one else would get it. No one else would understand why I'm crying because I ate a sweet and I couldn't help myself. So I think, just having that open connection and community is very, very important. Diksha, I just wanted to go to you quickly about one of the questions that were in the chat about which stage in life do you think is most difficult in terms of coping and living with type 1 diabetes? This is quite an open-ended question because we have not lived a full life, but I'm sure that you'll have an answer on that. And specifically, do you have any tips for children? Because I think children living with diabetes might show different signs that a person that is a bit older living with diabetes might be able to express. Do you have any tips on that?
Right. So from my practice, because I had a pretty cool teenage, as far as my parents tell me, I was never a finicky teenager who, rebelled against them, especially for eating stuff. But from the practice that I've had and from the conversations that I've had over a period of time, I think teenage, especially if you get diagnosed during teenage, or if you were, diagnosed pretty young and you enter teenage and you come into your senses that, oh, there's something different about me, not particularly wrong, but something different about me. That's the time when we have seen the most rebellion comes in, where you'll be like, the entire point of rebellion is you deny that you have anything. You get angry towards the condition. And that's where I think the role of parents come in. A lot of parents that I work with do get frustrated during such times. Why is our child not able to listen? Why are they not able to understand this? I think at that point of time, again, bringing in the peer support, right? Making them meet someone who is the same age. What I think one of us did flag that out, that Kristen, you only were talking about this, that you did not want to meet anyone of your age of, living with type 1. I think when a 14-year-old explains a 14-year-old how they see type 1, it makes all the difference again. Then you are like, okay, I am not alone. I am also going through this phase of not understanding what this is. Why don't I have to eat this particular thing? And you can, and the others can. So just, families connecting and coming together and talking about this is one way to go about it. Second is when a person gets into that teenage transitional age, basically, and then into the adulthood as well. Again, there's a shocker that comes in, that what do I have to do? Because from starting, you get into professional life, and it's a huge, huge change. And then you see a very different aspect of type 1 diabetes stigma that you might face professionally, because you might have had a very smooth journey during your college, but professionally you'll see you have to inject in the washrooms and all of that, then the stigma hits you suddenly. I think every stage is so different, but what we have seen is teenagers mostly get into this stage of not understanding what is happening with them, just not because of type 1, but otherwise hormonally as well. They need to speak to someone. It's simple as that. If I have to put that as flatly as possible, I think therapy, especially with a psychologist who understands what type 1 is, would really work. Those children need to vent out somewhere that, my parents are not letting me do this, this is happening, that is happening, and that cannot happen with the parents. They need a space, they need a safe space where they need, and they understand that they are being understood. So that's very important. For children, I think a lot of parents have this for newly diagnosed or with children as well. I think a lot of parents struggle with creating those boundaries with them, that you should not eat this and you shouldn't do this. I do get a lot of complaints from caregivers saying that my 5-year-old or 6-year-old just goes and eats anything at the school, and they come with a sugar level of 400. And what do I do with that, right? I think I am not going to say that it's okay, but make them understand in the easiest way possible. Just the fact that your child, you have to explain to them that your friends should not eat this every day. So should you. So, you be the idealistic person. And for a 5-year-old, I'm so sorry if this sounds berserk, but for a 5-year-old, just, being like, just create, you have to be the idol for them. And that's what I tell the parents, that you have to explain to you have to keep certain boundaries open till the time they are not old enough to understand their condition. So that's that. And just adding to that, just one last point is caregivers also go through distress. So they need to come and talk about it as well, because if they get frustrated, they will not be able to take care of their child, and they'll end up hating type 1 diabetes for the rest of their lives, which impacts children later on once they turn into adults, because they also end up hating type 1. So again, the compassion factor comes in. Just teaching your child that this is a healthier way of living, maybe in whatever way possible, still keeping some boundaries open, but yet, and also vicarious children, they learn vicariously. So you have to do the same things that you want your child to do. So you cannot expect them not to eat sugar, and you are eating sugar in front of them, or you are eating unhealthy, you are eating a pizza, and then you are asking your child to have a multigrain roti or, whatsoever, the healthier option apparently. you have to make the same lifestyle changes as them. And you have to create that model for your child to follow, because that's how they learn. So those are a few tips and tricks that I can give right now.
Wonderful. That was very, very valuable information. Thank you for sharing that. And it covered so many of the areas. And I think in my experience, my burnout happened specifically in that time where my parents were looking after me versus me looking after me. And it was that transition from school to college and getting that new sense of found freedom and kind of diabetes was just the last thing on my agenda. And my parents were no longer there to hold my hand every step of the way. And I think globally, there's a missing gap in that market for sort of the training that needs to take place between your parents and you looking after you. Ricardo, on to you. Do you have anything on this topic? And then you're welcome to go on to the next question.
Yes, I think we covered a lot of ground here. I would just add 3 cents or 2 cents. The first of all is I agree that the first step of creating this network or this community is to get involved. I spent probably 10 years in not in denial, but not in acceptance. I think it's quite important to understand that it's not black and white. It can be a gray zone. And yes, I think I agree with the grieving and the loss. And the way that people often cope with this loss feeling is by imposing limitations. And that's how we get to the I can't do this, I can't do that, and I can't feel like a normal person. Well, what is a normal person, you know? So I think it's quite an interesting point there. I also think that there's an important piece of advice that I would give myself and that I would give to everybody. I honestly believe it's quite important to look back and to think that when I was diagnosed, and people here that are listening to us, and even you on the panel, you were diagnosed earlier than me. So a lot has changed, right? So we can't really continue to hold the beliefs that I had, for example, 13, 14 years ago, right? So when I used blood strips, or when I used a different type of insulin, or a less fast acting insulin. So the world, and unfortunately, it's not even. So we don't have all the things and all the access everywhere, but we get there. Slower or faster, we'll get there. And my take here is that we need to upgrade our beliefs, and we need to upgrade the way that we manage aspects. And the most recent struggle that I had is this data overwhelmingness. So we have data everywhere, right? And for the ones that have access to CGMs and more connected, let's call it, devices, it's a blessing because you can have more information, but it's also a curse because you have a lot of information and you end up correcting numbers on the spot. And I think that in the end, we start seeing our days not as good or bad. We start seeing or judging our days by the charts that we produce. And everybody has bad days. Normal, let's call it, normal people have bad days. We just have a chart that shows us the bad days that we had. And we can be better, and we can be more mature and just overcome that. And I think that's a very good piece of advice that I give myself every other day. Yes, it's not because you had a roller coaster chart that it's a bad day. It's just a harder day, and tomorrow is a good one, or not. But let's see. It's every day is a new discovery, and it's a new adventure. Thank you, Kirsten, and thank you all for the inputs here. We spoke a lot about mental health, how to cope, how to be accepted, and how to discuss mental health. But I think it's quite important to go deeper into this and just look at what is this mental health and what is this diabetes distress that often might not be the same for you as it is for me. So for example, a week ago, having a hypoglycemia caused me a lot of distress. Today, it probably doesn't have the same effect. So it's often varying, and it's according to context, people that we are with. And often we also use diabetes distress as a way of masking up real life or everyday's life distress, and it's important to also understand how to distinguish them. So the first question or the first topic here is, how does diabetes distress look like, and how does a person going through diabetes distress looks like going through these phases? And as a Q&A question that we had, and thank you for the audience to continuing engaging with us on the Q&A, how do you explain this mental health question without seeming like you are exaggerating? So without going to somebody and said, like Kirsten said, so I called a friend and I said I had a bad day, and the person gives the unsolicited advice like, oh, have you tried this new diet? It's amazing. So how do we can avoid that situation? So I would start by asking, let's do a first round of, how does this diabetes distress looks like in your opinion, and how do you talk about it? And the last point, and I think perhaps it might be a little bit deeper, but why does it happen? Is it because we let it happen? Is it because it needs to happen and we can't just avoid the unavoidable? But let's start on, how does it look like? So Nasser, I would start with you, if you don't mind. So what does diabetes distress looks like in your experience and the ones that you have been in touch with?
Okay, can you just repeat so this is the first question. The next two questions, I think there is a lot of interaction between the next questions as well.
Yes, it's all a pack. So basically, it's just to understand, what does it look like? How do you communicate with your peers, which is something that is quite important that we've mentioned. And in the end, why does it happen? Because, for example, in my situation in the US that I was mentioning, and I don't have nothing against the US, it was just different. I'm a good European with the Mediterranean diet, and the distress was every time I went to have dinner, it was crazy. So it was really hard to manage, and it took a week to probably make me feel like I was dying, and this is distress. This is not real. So basically this.
I disagree. I think it's totally real. I don't think it's just the distress. I think with a lot of the accounts, like accounts as in stories about what I hear about distress, is, they tell people it's just in your head. I don't think that's a very good account of what diabetes distress is. I don't think it's just in your head or my head. What does it look like? I think, the reason why you had you kind of experienced a lot of distress when you got a hypoglycemia last week, but it didn't happen next week, is not necessarily because the hypoglycemia in itself is the significant event, but I think there is a lot of interaction between obviously life events, stress generally, and diabetes, right? Because the way I think about it, at least, or like to explain, is it's like a jug. And it just fills up, diabetes is just one of these components. So I think there is a lot of interaction between what happens in life and what happens in, in terms of your diabetes. Evidently, like evidence to that is what we're seeing with individuals in low socioeconomic levels and non-white individuals. So there is a lot of socio-political context that we have to be aware of here as well. So someone who comes from a low socioeconomic level would obviously have lower distress because there is less technology, there is less access, there is less resources, and there is all the other life stressors. There is discrimination, there's racism. So it's a full package. I don't think diabetes distress is kind of can be looked at just as diabetes distress. And this is why I don't agree with clinicians who just scream for diabetes distress. That's not the way to go. I think it should be a little bit more holistic. Communication, obviously, I can't tell you how to communicate. Sorry, I think I'm speaking from a place of a lot of anger. There's a lot of the research also speaks about when you have diabetes distress, this is how you should communicate it. No, no. With diabetes distress or with whatever you go through, I can't tell you how to communicate it. And with individuals that say, like it's exaggerated, I think being exaggerated in itself, for someone to have the need to exaggerate the diabetes distress to the extent to say, no, I'm dying, is that they're suffering from diabetes distress to a very large extent. So whenever we're looking at mental health, something like depression, kind of away from the example of diabetes distress, I don't think exaggeration kind of comes and becomes a part of the equation. No. How does it happen and what are the causes? I think it depends a lot on the theoretical frameworks that you come from. And I think it happens for a variety of reasons. One of them is, again, having low access to technology. And a lot of the research today is showing that, you know, kind of, you said, having a CGM is a privilege and it's a curse as well. And I agree, I've been on a CGM for the longest time. But again, because you have the CGM, you can say it's a privilege and you can say it's a curse, right? Because you have the kind of the privilege to access and you have the privilege to take it off whenever you don't want to. The kind of the choice aspect is very important here. A lot of the kids, a lot of the teenagers, back to what Diksha and Robin were referring to earlier, suffer from bullying in schools, right? A lot of the kids, I was a teacher, and a lot of the kids that I work with, a lot of the kids in my class had suffered a lot from, you know, not knowing what to do when their insulin pump beeps. They get freaked out, and I get it. To me specifically, it was advocacy was the way for me to kind of manage my diabetes distress. But I think it depends a lot of on the context, on the individual. Sorry, I don't have a very straight answer to that, but I think it's just so much more complex to have kind of a standardized answer, yani.
Yeah, no, and again, I think it's totally fair that we don't see it as something that it's in our minds, you know, and sometimes we commit this, not mistake, but this coping or this wrong coping of telling ourselves that, so that this is not real, this is something that it will pass. But in the same way, we should not put this under the rug, and we should actually address things because they build up and we don't have storage for everything. So I think that's quite important, and thanks for highlighting that. And I think it's quite an important remark. Diksha, I would pass to you and try to understand what's your experience here, and try to understand a little bit about your experience with the diabetes, and trying to understand if you had any experience, not directly with you, but also with people that you are actively supporting.
Right. Diabetes distress is as real as it can get. And it just does not, what Nasser said very rightly, it doesn't happen because of just one factor. There are multiple factors. And they might not be just the physical fluctuations that are happening with your sugar levels. It can be, what again Nasser said, bullying and unsolicited advices that you're getting, the diabetes policing that your caregivers or your friends are doing. Oh, can you eat that? Aren't you living with type 1? Just all those questions, you know, they lead you to a point where you start questioning your own self, that is this how I'm going to live with this? I can't do it anymore. So I think that phrase where you feel that hopelessness or helplessness, that I cannot deal with diabetes anymore, or I can't do this anymore, is the point where you be alarmed a little. I did not have diabetes distress or burnout. I at least faced distress when I celebrated my 20th anniversary, because the person I was with at that particular point of time, he made me question my diabetes so badly, because that was proper diabetes policing, that, you know, you are making everyone around you so worried about you because you're not able to take care of yourself. That kind of triggered me. That was the small trigger that, you know, just went really bad for me, and I had to get out of it on my own, because again, the support system bit did not exist at that particular point of time in my life. So I think once you feel, and it can be triggered by anything, it can be one thing, it can be multiple, you know, accumulation of multiple things that can cause diabetes distress. How to deal with that distress if you go through it? Again, first thing that I always tell is be compassionate towards yourself. I think you need a break then. Diabetes break does not look like your typical break, because you cannot stop taking insulin, you still have to monitor, but you can, you know, make shifts. Like if you are on a pump and you are just what Ricardo was saying about CGMs, right? If you're feeling that the CGM, you're constantly looking at the monitor and you're getting fatigued and you're feeling, and this has happened in my practice, that someone told me that, I feel judged by my reader or by my monitor. If you're feeling that, just remove it for a few days. Go back to your old-fashioned glucometer and try to monitor not for your typical 8 times a day, but at least do your pre-meals and your fasting and before you go to bed. The amount of monitoring that you're doing, you can lessen that, but do not stop monitoring at any point of time. Same goes for your insulin. Just if you are using a pump, you can remove the pump, or you can take a pump break, you can remove it for a few days, you can go back to your good old MDIs. So that helps. Second thing is building your own support system. What Kristen said about, calling a friend and being like, oh, I'm having a bad day. I know exact friends who understand my diabetes, even if they are not living with diabetes. And I have friends who are living with type 1 who understand my type 1 diabetes as well. So building your own village is so important, that you know exact people that you can go back to whenever you're feeling the need to talk to someone, that I'm having a bad day. You don't have to go to just any friend, because most of the times, most of the people don't understand what you're going through. So just finding that small, cute little circle or a triangle or a line, basically, maybe 2 friends who you feel understand what you go through and create that safe space for you to just rant. Even if they don't understand a word about you, telling them about hyperglycemia and how you just had a shitty, and pardon for my French, but a shitty diabetes day. But just having that is very important. Sometimes just going back to your support group and telling them that today I felt like I'm losing. Maybe just talking about that there, or we at Diabetes, since Ricardo, you were talking, we do a lot of emotional processing workshops that I lead. And we do a lot of listening circles where people can come and just talk about living with type 1 and their struggles or their wins that they have had with type 1. Lastly, remember that small wins count. If your HbA1c was 6.5% last time and now you're at 6.4%, trust me, you have done something better. If your sugar levels were, maybe you were at a time in range of 70% yesterday, but now today it is 71%, trust me, you are doing something good. You're doing it better. So those small wins count. Forget about the numbers. Let's not talk about numbers. If you did not check your sugar level, if you checked your sugar level 3 times a day yesterday because you were going through a terrible distress day, but today you tried to monitor yourself for 4 days, for 4 times, it makes a difference. If you had your meal on the right time, that makes a difference. All those small wins, they are important to be addressed. And that's how you actually prevent distress, because what we look at is the bad side of diabetes, but we don't look at all the wins that we are making consistently. And that's extremely important. So yeah, those are my insights.
Thanks for sharing. And the network, or the community, it's always a very important aspect to dwell on, and especially because we tend to see things as they are today and we don't see what they were. And I totally understand that it's hard for us when people comment, or for example, the feeling of being judged, not by the reader, but also for the person that sees your reader. We also need to understand that sometimes that's how people engage. And being in events with people younger, mostly younger people that started to have this condition and that are now understanding how to deal with it, it's very often the case that they will look at your graphs or your values or whatever you use, and they will comment and they will say that, oh, that's high, or oh, that's low. And one thing that we need to grow, and it takes time, we need to grow to understand that staying at the timing range of 70% might be offensive for some people that can't reach that. And for us, might be such a simple thing. So again, I think it's really important to have the community, but also be mindful that to get to the community level that we want, we might need to overcome these barriers and letting people in, and sometimes just grow with them. Robin, I would direct to you and just ask, and we are approaching the last mile of this.
I'll be concise. I'll be concise. What struck me as you were speaking was the importance of helping young people adjust to type 1. And I was thinking, what would be a great offering? People like yourself who are so well informed and compassionate, buddying up with newly diagnosed people, because we all agree the peer-to-peer element is so important. That's why sitting with you today, all of you, it makes me feel so much better. It takes what's a weakness or a feeling badly about myself to a source of great strength. So I was just thinking, like, that would be a cool program, a buddy program, where people already dealing with diabetes could have like someone like a peer, like a buddy. That would be so cool. Anyway, just that's why minds coming together come up with great ideas. Okay, diabetes distress. First thing I would say is you are more than diabetes. And I think people have to just, when we're in these distressed moments and we're just feeling the weight of this, we have to just push our minds out to remember we're way more than this, than our illness. I think one thing that I have a lot with diabetes distress is fear of complications. Because with all the information we have, which we know is a blessing, it also gives us this microscope, as you were saying, Nasser, like you have every little bit of detail and you get a little overwhelmed by all the information. And so I think for me, it's like, oh, I'm going to get this. Every time I look at something about comorbidities and other conditions, it's like, well, you're going to have this, you're going to have that, you're going to. So already that gets me very distressed, because I just think of my body as sort of like, it's going to fall apart on 100 ways because I have diabetes. So that makes me very distressed. And also the fear that I'm failing, that I'm not managing it right. And it's a battle. Should I do this? Should I do that? And I don't pass the test a lot because I did have the sweet, or I didn't take the walk. And then I feel very badly and I feel guilty. And that makes me feel distress. With me, because I've tried different medicines, there's different feelings of deflation. It's not working so well. I have these side effects. I don't feel well. And that brings my mood down. As we all know, all this stuff affects our moods deeply, like what we're dealing with physically, and then how it affects our minds. And that's another issue about mental health. When you're dealing with all these fluxes and it affects your mental health, it's not just in your head. It's in your body. Your body's saying, I don't feel well, too much sugar. I don't feel well, not enough sugar, and then we know what it does to us mentally. We feel badly. I think the paradigm that I've adopted is that I'm not in control. I don't have to be in control. I just have to find a gray area where I'm doing the best I can. And I'm not judging myself. I'm doing the best I can. It has like mantras that I try to get into. I kind of say them to myself. I'm not failing. I think what you said, Diksha, about compassion is bedrock. Go to compassion to fight these feelings, because you really are trying to live the best life you can and find the strengths you can, and deal with a disease that's very, affects every aspect of one's life. So I think we have to have compassion. And when we feel guilty, just, revisit, are you really doing what you need to do? Like, we all know what we need to do. We have to revisit, am I doing what I have to do, what I need to do? And I'm doing an okay job of it. And that kind of thinking, rather than I'm failing, I'm going to wind up with a leg amputation, all these things that I think make people feel that, a lot of fear. I think that's part of diabetes distress too, is fear. That's my experience of it.
Thank you, Robin. Thank you so much for sharing your thoughts on that. We've had so many wonderful discussions today, but we are wrapping up in the next 5 minutes. I'm sure that we could speak about this forever and a day. But thank you again for sharing all your valuable experience. The last question, we only unfortunately have 1 minute each to go through this, but what should be done to improve mental health in our countries? In your country specifically, do you think there is something that can be done? Again, we only have 1 minute each, so please try and keep this short. I'm going to go to Nasser first.
I don't have an answer. This is too stressful. Come back to me later. Yeah.
Okay, we'll go to Deeksha.
Start with shushing the stigma around mental health, normalize it. If you need a therapist, it's all right. Even if you're living with type 1, it's difficult. You might need help. So it's okay to ask for help, and normalizing that and having good mental health care facilities and psychologists and trained psychologists is extremely important. So that's where the government should start, looking at least in India and rest of the countries as well.
Thank you for sharing that, and we hope that that comes to fruition in India. In South Africa, specifically in my context, we are working at building clinical advocacy, so getting healthcare professionals that are interested in advocating for people living with diabetes, coming together on different topics of conversation, whether that be access to better access to care, or whether that be psychological or mental health support, whatever that may be. We are building a list of healthcare professionals that are wanting to advocate for people living with diabetes, and we're hoping that through that connection, we'll be able to transform access to mental health care in South Africa. Robin, on to you.
Yes, I would say that what I see as a very major initiative that would help in the United States is having endocrinologists and internists who are the medical managers of the disease, getting them more on board on the importance of mental health and support, and not becoming obstructionist towards it, which is what I've experienced, minimizing the effect of coping with a chronic illness. And there's an obstructionist attitude, which I don't quite understand. So I would say that more education for healthcare providers about the need for mental health would be very critical. And I would say start with medical schools or nursing schools, get them on board more.
100%. That is very valuable feedback there. Nasa, are you ready?
I don't know. I think it's an ongoing conversation. I don't have an answer, honestly. Yeah.
Perfect. Wonderful. Ricardo, over to you.
Yes, I would add that I think mental health will be easier to manage in the day that it's as easy to see a psychologist as it's easy to go to a medical doctor. And when it happens, I think we all benefit, living or not living with diabetes. So that's my summary take.
Wonderful. Thank you so much again for sharing everything. We are going to go to the closing remarks. Thank you again, everyone, for attending. The recording, slides, and feedback questionnaire will be sent to all registrants in a few days' time. Please respond to the feedback questionnaire to help us improve future International Diabetes Federation online events, and send any questions that you may have to advocacy@idf.org. Thank you.
Thank you all. See you next time.